Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Point 5 STIs and STDs that condoms don't always prevent: sexually transmitted diseases, STDs, or sexually transmitted infections, STIs, are infections that are spread through sexual activity with another person. Condoms are a birth control method that protects against certain STIs. /r/n/r/n However, condoms are not 100% effective, even when used correctly. People can still transmit or acquire an STI when using a condom during sex. This article provides an overview of which STIs external condoms may not prevent and how to increase a condom's effectiveness. /r/n/r/nPatrick Sheandell OCarroll, Getty Images /r/n/r/n Sexually transmitted infections, STIs, refer to infections transmitted by sexual activity, which may not have noticeable symptoms. Sexually transmitted diseases, STDs, refer to infections where symptoms are present. This article will use the terms STDs and STIs interchangeably. /r/n/r/n Two types of condoms can be used during sexual activity. An external condom covers the shaft of the penis. An internal condom is inserted into the vagina or anus and lines the tissue. /r/n/r/n This article will address the effectiveness of external condoms. These types of condoms may be made of latex, polyurethane, or polyisoprene. We will not discuss lambskin condoms because this type contains tiny holes that allow genital fluids to spread infection. /r/n/r/n In the past, internal condoms have been referred to as female condoms. This is an outdated term. /r/n/r/n Condoms are the only contraceptive method that protects against STIs. However, transmission can still happen. Condoms are not 100% effective even when used perfectly. Certain STIs can be spread through skin-to-skin contact. /r/n/r/n Condoms are a very effective prevention method but not 100% safe. Planned Parenthood estimates that most condoms are 98% effective when used perfectly and more likely 87% effective in real life. /r/n/r/n Most STIs have two ways they are spread during sexual activity: through skin-to-skin contact and or bodily fluids. Anyone who is sexually active with another person is at risk of contracting an STI. /r/n/r/n A person with an STI can transmit it through contact with their skin, genitals, mouth, rectum, or body fluids. STIs can be transmitted through vaginal sex, anal sex, and oral sex. /r/n/r/n Condoms cannot prevent the transmission of STIs that are spread through skin-to-skin contact. Also, condoms may fail to prevent transmission of STIs spread by genital fluids or blood if they are not used correctly or have a leak, hole, or tear. /r/n/r/n Condoms protect against STIs spread through genital fluids such as semen, vaginal secretions, and blood during sexual activity. Because condoms are not 100% effective, they lower the risk of but may not protect against the following infections every time. /r/n/r/n Condoms do not protect against STIs spread by skin-to-skin contact. Many of these STIs cause sores or skin irritation in areas not covered by an external condom. STIs spread through skin-to-skin contact include /r/n/r/n The only way to protect yourself against STIs spread through skin-to-skin contact is to avoid sexual activity. Most healthcare providers recommend abstaining from sex when you have an active herpes outbreak because this is the most infectious time. /r/n/r/n The best way to increase your condom's effectiveness, is to use it correctly. Using condoms during sex significantly reduces the risk of transmitting STIs. It is essential to use condoms every time you have sex to protect yourself and your partner. /r/n/r/n external condoms come in different sizes, and finding the right fit is important. Using a condom that is too big could allow some semen to leak out during intercourse. Using a condom that is too small could cause a report here during use. /r/n/r/n store condoms in a cool, dry place that does not get direct sunlight. You may choose to keep them in a bedside drawer or closet. When carrying condoms with you, keep them in a small tin or other protective carrier to avoid damaging them. /r/n/r/n condoms do not last forever, so check the expiration date on the box before using them. Most condoms last between 1 and 5 years. /r/n/r/n always use your hands or fingers to open a condom's packaging. Attempting to open a condom with your teeth can cause damage to the condom. Some tears or rips are so small that you cannot see them. /r/n/r/n for a condom to be most effective, it is important to put it on before any genital contact. Some genital fluids can leak out of the penis before ejaculation. Put the condom on an erect penis to ensure that the fit is correct. /r/n/r/n it is essential to roll the condom the right way to ensure its effectiveness. Condoms only work when rolled the right way. They do not protect against STIs when put on inside out. /r/n/r/n place the tip of the condom on the erect penis with the rolled side out. Pinch the tip of the condom to create a small gap at the top of the penis and unroll it to the base of the penis. /r/n/r/n throw away a condom after ejaculation. To safely remove it, grip the rim of the condom and carefully pull it off the penis, making sure not to spill semen. Wrap the used condom in a tissue and throw it away in the trash. Never reuse a condom. /r/n/r/n Fortunately, it is possible to minimize your risk of STI transmission. In addition to using condoms correctly, be sure to know your STI status and share it with any sexual partner. /r/n/r/n know your STI status by getting tested with your primary healthcare provider, public health department, or an STI clinic. The Centers for Disease Control and Prevention, CDC, has recommendations for how often to be screened and when to repeat STI testing. /r/n/r/n the CDC recommends that people assigned female at birth who are under age 25 and sexually active be screened for chlamydia, gonorrhea, HIV, HPV, and hepatitis C. People who are at increased risk, such as those with several sexual partners, need more frequent testing and testing for other STIs. /r/n/r/n people who are pregnant are also tested for STIs that can affect the fetus or be transmitted to the newborn during childbirth. /r/n/r/n the CDC recommends that people assigned male at birth be screened for certain STIs. The specific guidelines vary based on a person's sexual history and partners. /r/n/r/n the CDC recommends people who are transgender or gender diverse work with their healthcare providers to determine the right screening schedule based on their sexual history and anatomy. /r/n/r/n while STI screenings and testing are important, there are limitations. For example, there is currently no way to screen people assigned male at birth who have sex with people assigned female at birth for HPV. /r/n/r/n the CDC does not recommend regular screenings for every STI. Talk with a healthcare provider about your risk level and when to get tested. /r/n/r/n it's common to feel uncomfortable or awkward about bringing up the topic of STIs with a partner. The best time to talk with your partner is before you have vaginal, anal, or oral sex. /r/n/r/n when asking your partner about their STI status, it may be helpful to share the date of your last STI screening. This can help the conversation to feel less accusatory and more like an open discussion. You may choose to share that the conversation feels difficult or uncomfortable for you but that it is important to you. /r/n/r/n. If you suspect that you have been exposed to an STI, talk with a healthcare provider. There are different waiting periods for the various STIs. It may take days to weeks to develop gonorrhea, chlamydia, and syphilis after exposure. It may take up to 3 months to develop HIV after being exposed. Ask your healthcare provider the best time to get tested and if repeat testing is necessary. /r/n/r/n. Learning that you have an STI can bring up a range of emotions. You may feel overwhelmed, confused, or embarrassed. It is important to remember that STIs are very common, and millions of people have been diagnosed with one. /r/n/r/n. Once you receive a positive test result, stop having sex right away. Talk with a healthcare provider to understand your diagnosis and treatment plan. Many STIs are curable with treatment. If your provider prescribes a medication such as an antibiotic, take it exactly as prescribed. /r/n/r/n. Once you talk with a healthcare provider and begin treatment, plan to talk with your current partner and contact past partners. This step often feels uncomfortable but is important. /r/n/r/n. When talking with your partner, try to avoid blaming one another. This is a stressful topic, and it's natural to jump to conclusions. It is possible to have an undetected STI for months or years. An STI diagnosis does not automatically mean that someone cheated or behaved irresponsibly. /r/n/r/n. It's natural to worry about your partner's reaction. They may need to take some space to think and process their emotions before they're ready to finish the conversation. If you fear that your partner may get very angry or become abusive when you share the positive test result, call 1-800-799-SAFE or seek out resources at the National Domestic Violence Hotline website. /r/n/r/n. Sexually transmitted diseases, STDs, and sexually transmitted infections, STIs, are infections that are spread through sexual contact with another person. Condoms are an effective way to lower the risk of spreading or contracting an STI. /r/n/r/n. Using a condom during sex significantly reduces the risk of contracting an STI spread through genital fluids. Examples include chlamydia, gonorrhea, and trichomoniasis. Condoms cannot protect against STIs spread through skin-to-skin contact. Examples include HPV, herpes, and syphilis. /r/n/r/n. To increase your condom's efficacy, focus on using it the right way. Always put on a condom before engaging in any genital contact with another person. Ensure that the fit is right, and roll the condom onto an erect penis with the rolled side facing out. After ejaculation, carefully remove the condom and throw it away. /r/n/r/n. If you suspect that you have been exposed to an STI, talk with a healthcare provider right away. Avoid sexual contact and get tested. STIs are very common, and many are curable. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.